Well, Zach, I've been looking forward to talking to you. How are you doing today?
I'm doing great. Thanks, Rob. How you doing?
I am well. I appreciate it. And I think that's a good way to start off, even though it seems kind of generic, because we're talking about healthcare and we're talking about how to get access to medical professionals on a more regular basis. Something that feels like telehealth, I guess, as a term, has really taken off primarily out of necessity. But as people have gotten more used to this, I'm excited that Webex is making it even easier with something called Instant Connect. And I wonder if you could help me understand more about what that is.
Sure, I'd be glad to. So Webex Instant Connect is a solution built by Cisco that's going to enable all of our customer base in the healthcare industry to be able to integrate very easily and very sleekly into their electronic health record systems and other healthcare systems in order to be able to enable virtual visits between their healthcare providers and their patients. So an easy to use solution, have your healthcare providers meet with their patients from anywhere, from any device.
I want to dig into that a little bit further because I want to make sure I understand. So we're talking about, when we talk about virtual visits, we're talking about enabling, let's say that, just keep it simple. I want to meet with my doctor, and similar to how we are doing right now, this is a simple way to potentially do this over with video. And I guess it's the integration that I get hung up on. We're not creating any kind of medical platform here, right? How simple is this? What's kind of the delivery model?
Right. So we enable our customers with tools that they need in order to enable this particular solution in any system.
Okay.
So we're not tied to a particular vendor. All they need to do is leverage the tools that we give them, and they can distribute links to a virtual visit however they see fit. If they want to have it available inside of their medical record, they can do so. If they want to have it available through SMS or email, they're simply sending a link with a fit for purpose application for a virtual visit to their healthcare providers and patients, and it's one click and they connect.
Well, I would like to make it easier for me to get in touch with my doctor because I've not been happy with I don't even know how they're doing it. I just know it half the time that it doesn't work. But can you walk me through kind of what is the experience? I assume it's not doctors that really are the ones that mess with this on getting it set up and ready to go, but they're definitely the ones that are going to be using it when it comes to daily, or at least their staff. What's involved from the medical provider side to get this going, and kind of what does that experience look like?
Sure. So the beauty of this particular product is that it's totally up to our customers what they want to do with this particular solution. Like I mentioned before, there's a bunch of different ways to distribute access to these virtual visits, and it's up to the customers and their stakeholders to figure out what is best for my healthcare providers, and more importantly, what's best for my patients.
Okay, so it's very straightforward. And so let's flip over to the patient side, and I'm just kind of curious about the interaction there. So I would assume that to really increase accessibility through this, you guys have focused on making this simple. What's involved for me or anyone else as a patient on this?
So there's not much involved at all. Whether or not you have to access a medical record or some sort of application in order to access the virtual visit ultimately is entirely up to your medical organization, your healthcare organization. But in terms of actually accessing a virtual visit, there really isn't much. We care a lot about the efficiency and the sleekness of this particular solution. So what we did is we built a client-less solution to make the process as efficient as possible. So they're not required to download anything, whether it's a plugin in their browser or an actual application itself, such as Webex, on their mobile devices or on their desktop. They're simply clicking on a button, it's launching a browser application, and they're just sitting there waiting for their healthcare provider to start a virtual visit.
I can't tell you how happy that makes me, because I like things that just work. And you're talking about something that really, I don't know if it's a single click, and it probably depends on the provider, but essentially from the Cisco perspective, the customer is not even, it sounds like, needs to be aware that it's Webex on the back end. Everybody is just doing what they need to do, and the video and the audio is being shared. Does the patient need to log in or have any kind of Webex account or any kind of credentials like that?
Nope, not at all. As a matter of fact, we pride ourselves in the fact that our patients are going to be completely anonymous to Cisco. Of course, there is certain personal health information that's being spoken about during these virtual visits, but Cisco never collects any personal health or personally identifiable information under any circumstance. To us, the patient is completely anonymous.
Gotcha. Okay. So you got the simplicity, and then it sounds like security. So I think the official terms, you can correct me if I'm wrong, PHIP, and then there's another one, a PH. PII, that's what it was. Personally identifiable information, something like that, and health information. So all that stuff, of course, Cisco has been encrypted from end to end with Webex from the get-go. It was always built as being a security-first application. So it sounds like that's extending here. Browser based, so it's client-less. I almost flopped those two by accident. Well, let me throw this curveball at you then. Let's say that I'm taking care of my mother, and I'm kind of an advocate for her, but she's in a different city. and I'm trying to help her interact with the doctor, because I sometimes will step in to translate, and just kind of maybe take better notes and kind of keep things aware. Is it possible for this to have, even though you're saying how simple it is and eliminating options, but what about having multiple parties on either side of that call, doctor side or patient side?
Absolutely. So we actually support up to 100 participants in any virtual visit. And there's a bunch of different ways that you can actually add additional participants to a virtual visit. Our application natively offers the ability to send out links via SMS or email. We also provide dial-in numbers, meeting numbers if you want to access the virtual visit through Webex. There's a plethora of different ways that you can add other participants and make it extremely easy to access.
Wow. This feels what I like about it feels very light. And so we're not part of the medical. Obviously, there's probably more application providers on the medical records side than I'd ever care to understand. But the idea is that doesn't matter, because the way in which we interact is pretty standards based, it sounds like, and it doesn't affect that. Simple to implement. And then most importantly, patients can do this. And it sounds like, just to make sure I'm clear on this one, since it's browser based, that means any device. So mobile phone or PCs, Macs, whatever you have laying around, right?
Yep, any device.
Perfect. Well, Zach, I like what you guys have done here. Is there anything else I forgot to ask you that we need to make sure and throw in?
I don't think so. I just want to reiterate very quickly that this is the sleekest, most secure solution on the market, and we're excited to get started.
I'm excited for us, so to speak. Awesome. Zach, thank you so much. I appreciate your time.
Thank you.